Welcome to everyone. My name is Tamsin Rose and I have the great pleasure of moderating our session. We've blocked the time from 3 until 5. Just to let you know, this was originally going to be an in-person meeting. It's been converted to a webinar for obvious reasons. The COVID-19 is shutting down all non-essential travel, so please bear with us. We've had to very quickly adapt the agenda to the online environment. The good news is it means we can involve more people from around the world, but it means we're still testing out how all of these things work. So in advance, my apologies if the technology lets us down in any way, and it's not as smooth as we hope it would be. So our focus here with the European Kidney Forum 2020 is to explore what can be done in Europe to further a shared vision on improving organ donation and transplantation in the EU. And we will be discussing and building on an activity, and people will be speaking about it. You'll find the link to this available in other materials, which is a joint statement on this shared vision for improving organ donation and transplantation. If you would like to tweet, it would be helpful for us if you could use the hashtag, which is EKF 2020. You see that on screen. Our event was originally going to be held in the European Parliament, which closed down because of COVID-19, but we do have a short video from an MEP who is supportive of our work. So now I'd like to share the message from MEP Hilde Votman, who is from the Renew Europe group in Belgium. Let's hear her message.
As chair of the MEP Group for Kidney Health, I would like to welcome you all to the 2020 European Kidney Forum, Europe's leading policy event on kidney health. A shared vision for improving organ donation and transplantation in the EU beyond 2020. That's the theme for this year's edition, and even the coronavirus cannot stop us from addressing this important issue today. It's really a blessing that years ago humanity discovered that organs can be transplanted. We truly altered people's destinies. Through organ donation and transplantation, we are able to change and even save people's lives. This is remarkable. It truly is one of greatest medical achievements, and methods continue to improve each day, resulting in an increased lifespan and a better quality of life for our patients. However, we can only save lives through transplantation if there are enough organs available to transplant. Today, one of the main challenges that we face in relation to organ donation and transplantation is organ shortage. In 2015, more than 134,000 people in the EU were waiting for a transplant. On average, 18 patients die every day waiting for a transplant. There are real people behind these numbers. Family, loved ones, mothers, fathers, children. This is unacceptable. If we want to save more lives through organ transplantation, we must take actions to increase organ availability, and we can. Our current legal framework, which defines the standards for organ transplantation, the so-called European Organs Directive, lays down the quality and safety standards for organs and covers all steps in the transplant process, from donation through procurement, testing and handling to distribution. However, this legislative framework is also more than 10 years old. Since the drawing up of this legislation, a lot has changed. The world has changed. Technology and know-how have changed. Is our current framework fit enough for today? Is our current legislation fit enough for the future? Maybe the time has come for a thorough assessment of the existing legislative framework on organ donation and transplantation. What is working well? What is not working well? Where is room for improvement? The same goes for the European Action Plan on Organ Donation and Transplantation. You may recall that this action plan ran from 2009 to 2015. It strengthened the cooperation between EU member states and assisted EU countries in addressing the shortage of organs, enhancing transplant system and improving the quality and safety of transplant products. Back in April 2017, I asked the Commission if it intended to draw up a replacement for the action plan. Back then, the Commission responded that it would wait on the outcome of the impact study on the action plan in order to assess whether to draw up a new actions. That study showed that the action plan was a tremendous success. The total number of organ donors at the EU level increased from 12,300 to 14,900. At the same time, there was an increase by 4,641 transplants, from 28,066 to over 32,707. Moreover, EU member states expressed the view that the action plan has helped to improve their national policies and activities on organ donation. Many among them expressed the need for a new, improved action plan, benefiting from the lessons learned from the previous one. So what are we waiting for? Ladies and gentlemen, with Ursula von der Leyen, a doctor, as our new president of the European Commission, we definitely have an unprecedented window of opportunity. An opportunity for change. An opportunity to really deliver for patients. An opportunity to ensure durable access to high quality care for all European citizens, with particular regard to organ transplantation. As stakeholders and policymakers, it is our duty to raise awareness, to pave the way for change, and to grasp this opportunity. Let us therefore revise the effectiveness of our current legal framework, and let us launch a new European Action Plan on organ donation and transplantation for 2020 and beyond. This will allow us to increase the total number of transplants and the total number of deceased and living organ donations. We must do this now for the benefits of the thousands of EU citizens that are eagerly waiting for our transplants. Let's make it happen. People's lives depend on it. Thank you very much.
Excellent, thank you. So we had a very clear and powerful call from MEP Votman in the European Parliament to say that there are real people behind these numbers of 134,000 people on average on the waiting list, and to say that, you know, we have the tools, we have the knowledge, and we can see that action plans can result in more donors and more transplantation. So let me now pass the floor to get some experience of what it's like to be a patient, to get a kidney patient, and to see how that has an impact on people's lives. So I'd like to pass the floor now to Fiona Loud from Kidney Care UK, who is a transplant recipient, one of the people who we spoke about, who needed a kidney and was able to receive one. Fiona, let me pass the floor to you.
Thank you very much, Tamsin. Now, I'm hoping that the slides are going to come up in a minute, but as you rightly said, I am one of those people that Hilda Voltmans just spoke about so very, very powerfully. And I'd like to spend a few minutes, if that's okay, just telling you a little bit about what it's like to have kidney failure and what it is like to be able to benefit from that amazing thing, which is an organ transplant. So I'm with Kidney Care UK. We are the UK kidney patient support charity. And I look after the area of policy there, which means I'm happy to work with politicians and other policymakers all about improving access to transplantation. So if I could have the next slide, please. hopefully. So Hilda just spoke about across the whole of Europe, but I'd just like to just put that in context for one country here. So every day, 20 people will develop kidney failure, and about half of those will be added to that transplant list. But every day, somebody will die while they wait for a transplant. And every day, several people will be too poorly to be on the transplant list anymore, and they will be taken off the list, and they will probably die also in due course. So, because people just don't always have very long to wait. So if I could have the next slide, please. I'd just like to start a little bit about my story. So if I could have the next point, please. So quite a long time ago, when I was a student at university, I tried to give blood, as many students do. And I found that I had anemia, so my iron levels were very low. But nobody ever explained to me that that actually might mean I had kidney problems, and that it is in fact quite unusual for an 18-year-old to have anemia. So my time went on, and I got married, and it took me a long time. That's a long time to have a child, and I didn't realise that this was part of the reason behind it. But when Emily was due to be born, I had something called preeclampsia, which means that everything became very dangerous very quickly, and my kidneys started to collapse, and she had to be born 2 months early, in fact. In the end, we were both okay, thankfully. If I could have the next point, please. Yeah. So this was on top of the fact that I had got chronic kidney disease, but I didn't know I had it. And unfortunately, if you don't know you have something, and then, for example, in my case, I became pregnant, that did result in a bit of a crisis, unfortunately. So time went along a little bit. I still didn't realize I had kidney disease. But through sort of an unrelated scan, I found out that I actually had kidney cancer. And that was a call that I was very, very upset to hear about. So if I could have the next point, please. It took quite a long time and quite a lot of tests to be diagnosed with the fact I've got this a rare kidney condition. It's called tuberous sclerosis. There are many others out there, but this was my particular one. So if I could have the next slide, please. So I was told at that point, when my children were probably 3 and 5, that I was going to have kidney failure, and that would probably be about 3 years' time. However, 15 years' time. However, it took 3 years. So they were very, very young. They were still in nursery, and I had to move on to dialysis, which perhaps people don't know, that usually is 3 times a week, 4 or 5 hours at a time, in a hospital or at home, and it becomes all consuming because you only have about 10% of your kidney function, so you lose a lot of energy, and your diet is very, very restricted. And you'll see me, I've been drinking plenty. You can only have probably about half a litre of fluid every day, so it's very, very challenging. And then your bones start to ache as well. So I had to give up work because I just wasn't well enough to work. But obviously, and for my family and my children, that was very, very difficult as well. My husband too. Next point, please. So I mentioned my husband, Keith. He came forward as a donor during this time and said that he would want to give me his kidney. Next point, please. However, I didn't get the best advice at the beginning of my journey because we were told that I should wait for a deceased donor. And now I realise we should have gone forward with a living donor, and I perhaps could have avoided those years on dialysis. However, that wasn't what happened. So next slide, please. So there we are. I've just talked about my children. You can see what we were like quite a long time ago. We're just a completely normal family. And that's Emily and Tom, who are obviously grown up and in their 20s now. But that's what it was like. That's what it was like at the time. And for them, as I say, and for Keith, it was very difficult because their mum was really unwell, and they had no idea why I was so tired all the time and why I kept having to disappear off all the time. Next slide, please. So as I say, I mentioned the kidney cancer, I had 3 years on dialysis, and just a couple of weeks before Keith, my partner, was going to donate to me, I had a final scan, and we found out that I had a return of the kidney cancer, so I wouldn't be able to have that transplant. And that was that Christmas, which was, of course, very, very upsetting. And all I remember is my son said, "Oh, Mummy, are we still going to have Father Christmas this year?" And of course we did, but it wasn't easy. Next point, please. So it took another 2 years before I was able to have my transplant from Keith. I had to wait to be clear of the cancer. Next point, please. And not everybody is able to wait this long. about 50 to 60 people, 50 to 60% of people who start dialysis will have gone 5 years later. So you can see why I made that point about if you are able to have a transplant, it's far better to have one sooner rather than later to be able to benefit from not being able to go on to dialysis. Next point, please. So I do consider myself to be very fortunate to be well, as you can see, and working hard on behalf of other kidney patients to be able to share that story and be able to hopefully work towards improving this stuff. So if I could get to the next point, please. So I just wanted to kind of say to you that living donation is very important. If you look at those figures there, okay, that's just for the UK. I know Hilda talked about the whole of Europe, but there are nearly 30,000 people just in the one country at the moment on dialysis. And that was probably a week or two ago, but that's approximately the number of people who are waiting. So these are real lives with children just like Emily and Tom, who I just showed you. And over the last sort of 11 months, that's been the sort of donations we've been able to have. So living donation needs to be part of the future plan. And you can see living donation is about 1/3 of all the transplants. And it's very important that we keep our eyes on that as well, because not everybody can wait that long. And actually, if you are able to have some people benefit from living donation, that does leave more room for others to be able to receive donations from the deceased donors as well. So if I could go on to the next slide, please. So as you can see, I've talked about him quite a lot. So this is us now, a couple of weeks ago, doing a little bit of local media. And as you can see, we're both well. Having a transplant is a treatment. It's not a cure, but it's the best treatment there is. And of course, we have to look after our kidneys very well, but we also have to look after our donors very well. I'm just very lucky that I happen to know mine quite well, having been married for a long time. If I could have the next slide, please. So some of the things I would very much like to get out from this meeting and from the shared vision that we're all working towards will be that promotion of organ donations and donation and resources. Because if you think back to that, right back at the beginning when I told you I first found out that I had anemia and I wasn't able to give blood, there was nothing then about organ donation. I had no idea. I'm happy to say I did put my name on the organ donor register even when I was 18, and I had no idea I might be in need of a transplant. And by the way, you are much more likely to need a transplant than to ever actually become a donor. So promotion across the world is incredibly important, and putting resources there that are easy to get. Next point, please. So that involves, and I know we'll talk about this a little bit more later on, but education of public. I can't emphasize that point enough. But emphasize to the public so people can understand what organ donation truly means, and that it is something that they can all contribute to, and that they are the most absolute heroes should they do so. But also education of medical staff, provision of that good information. I've talked about living donation. Next point, please. I'd like us to be able to measure the improvements we get. Hilda just referred to how we've done really well for the first 5 years, and now it's time for another 5 years. So let's look at the level of awareness we've got at the moment. Let's look at those improvements that are working and measure them so we can be able to work out how well we've done. And then nearly finally, the next point here, reporting back, being agile so we can recognize as things change. And the next point, please. Sharing good practice and technology. I'd like us to be able to do that as we go through the next few years. And just really as I come towards the end here, and I think this is probably my last slide, in England, we talked about the need to sort of improve education and resources, but you may be aware that the law is changing to opt out. And we do think, and there are some other countries in Europe that have gone that way as well, and we do think that's a really positive way of changing the whole conversation. Families will still be involved, but donors will be deemed to be, people will be deemed to be donors unless they've chosen to opt out in life. And it's happening in May 2020 here, it's happening in Scotland, it's already happened in Wales. And you asked me what I would like to see across Europe. I'd like to see more of a look at that as well across the other countries too. And I think if you could just press the next button. Yes, I think that is me. I thought that was me done. So thank you very much for everybody. Thank you for listening. I hope that was helpful.
And that was very clear and very positive to hear your story, and also you were very lucky to be able to, after many years on dialysis, to be able to benefit from a transplant. It's good to see both you and your husband doing well.
Thank
Let
you.
me now pass to our next speaker, who you can see on the screen. That's Professor Ray van Holder, who is the president of the ECHA Forum. And he's going to be describing what I'd mentioned earlier, which is the shared vision that's come forward from this thematic network on improving organ donation and transplantation in the EU. Ray, let me pass you the floor.
Okay, thank you very much. I'm waiting for my slides, but in between I can announce already what this will be about. We will, in a nutshell, summarize what is written down as a joint statement from the thematic network on improving organ donation and transplantation in the European Union. This was coordinated by European Kidney Health Alliance. And just to explain to you what Kidney Health Alliance is about, this is a Brussels-based NGO defending the case of kidney patients and the nephrological community at the level of the European Union and from top to bottom, also at national level. And we are an association that brings together the four major stakeholders in kidney disease, which are the physicians, the nurses, the patients and the foundations. So if you look on the right side on top, you see our full members, which are large European societies representing these four stakeholder groups, but we also have affiliate members which are below and which are national nephrological kidney-related societies, not necessarily medical, but also patient or nurses. The next slide. And ECHA has done a number of things in the area of kidney disease. If we are going from the left, sorry, go back please. From the left to the right, we wrote in 2015 ECHA recommendations on sustainable kidney care, which contains a number of recommendations to keep kidney care affordable for society and still at sufficient quality and open for access to every valid candidate to receive it, which comes in several subtopics where transplantation is one of. Below that, you see that all these thoughts were written down in a review paper on reducing the costs of chronic kidney disease in Nature Reviews Nephrology, which is for the time being the most important kidney disease journal. And if we then go to the top again, then you see the European Kidney Forum that we organize every year to discuss one of the major topics in kidney disease, which also was to be organized last week at the European Parliament. But as you know, coronavirus came in between. And so this webinar is now replacing this Kidney Forum. And finally, in 2019, we were asked by the European Commission to write the joint statement on organ donation and transplantation, which is now the topic of this forum. Next slide. Now, of course, transplantation is not only related to kidney, but also to many other solid organs and also to cells. And among solid organs, there are also lungs and liver and bowel and heart, which are important. And therefore, this joint statement is also a joint initiative of several groups that are related to transplantation. The next slide. Which are, amongst others, the European Society of Organ Transplantation, then a number of learned societies that are related to major transplant organs, kidneys, but also liver and bowel, and then a number of representatives of national competent authorities, which are strong in transplantations, such as those from Croatia, from Spain, and from the Netherlands. And several of these people are members of the panel that is going to hold a discussion in a minute. Next slide. Now, without going into detail, we have to be sure of the fact, and there is a lot of evidence on that, that transplantation is prolonging and saving lives, especially for those organs where there is no alternative, but also for a kidney where there is an alternative, which is dialysis. But people on transplantation on average live twice as long as dialysis patients. It improves quality of life and it decreases healthcare costs, which is the most striking again for kidney, where dialysis is costing about 10 times more than transplantation in a year. The next slide. Now, as Mrs. Woutmans already emphasized, there was an EU action plan in 2009, from 2009 to 2015, with 10 priority actions. The next slide. And this resulted in a steady increase of transplantation rate. If you go from the left to the right over 10 years, from 2009 to 2018. And if you count up everything, then there is a rise in frequency by almost 16% over those 10 years. So this action plan was successful. The next slide. However, if we look at data per EU country, and as you can see, UK is still included because in 2018 they were still part of the European Union. The length of the bars is representing the number of transplants per million population per country. And you see on top that the list is headed by Spain with a donation rate around 55 per million people per year in 2018. But as you can see, down the scale, this bars become smaller and smaller as you are going down the road. And for the lowest donation rate, there is a factor of about 10 times less as compared to Spain. So for all these countries, there is obviously room for improvement. And even in Spain, transplantation and donation rate is still going up every year. Now, as you can see, there are also several different colors. The blue bars is the classical deceased donation of brain death donors. The green is representing living donation, and the red is representing deceased donation after circulatory death, so-called non-heart beating donors. So again, it is clear, as there are such huge differences among countries, that there is room for improvement in many, if not all, countries. You will also see that, for instance, for living donation, there are enormous differences. Here, the list is headed by the Netherlands, but the main transplant country, Spain, on the other hand, is obviously having less living donation. And then for the red, this is deceased donation after circulatory death. And there you can see that for more than half of EU countries, there is actually no activity at all. And for many of the others, it's also minimal. There are only 4 or 5 countries that are really doing well. So there is a lot of room for improvement. Next slide, and that is also illustrated on this slide, where you see a comparison per country between 2009. These are the light colored bars on the left side, and then for the same country, the darker bars for 2018. And then, as you can see with the asterisks, there are a number of countries, I think about 10 or 11, where there was a rise by more than 20% over those 10 years. So that is a real success. But on the other hand, you can also see that there are many other countries where there is a stagnation or even a decrease. So I think that we need more focus on all those countries, perhaps in clustered groups, depending on their characteristics, to further improve and enhance transplantation rate throughout Europe. The next slide. That was the reason why we decided to participate in this initiative and to coordinate this joint statement on organ transplantation and donation. The next slide. which was supported and endorsed by 19 members of the European Parliament. Next slide. And also by not less than 54 stakeholder organizations, which just emphasizes how important this issue is and how much concerned so many people throughout Europe are with this problem. Next slide. Now, the joint statement falls apart in two major sections. One is called calls and recommendations, and this is guidance for the European Commission, for EU countries and for stakeholders on how to improve the transplantation throughout Europe. The next slide. And this is subdivided in 8 major sections, which if we go from 1 to 8 is on policy initiatives, on legal and institutional frameworks, on 3rd on organization, 4th on funding, 5th on education and training, 6 on inequities in access to transplantation, 7 on benchmarking and on registration, and 8 on research. And I'm sure that many, if not all, of these topics will be addressed in the discussion that follows. Next slide. And the second part is a rationale that is an evidence-based scientific text that is underpinning those recommendations. And this is then subdivided in 14 major key topics, but we don't have to go into the detail what is written there. Those who want to see the details are kindly invited to go to our website, and you can open the joint statement and have lecture of the entire document. Just to finalize, I want to stress a few of the lessons learned. This is certainly not everything. So here come some of the key takeaways. First of all, as you have seen during this presentation, there are substantial discrepancies in transplantation rate throughout the EU, and there is a need for more harmonization. One of the key issues is that what needs to work really very well is donor coordination and intensive care processes, because it is over there that it happens. It defines the number of donors, but also the quality of donors if this is going very fast. And quality of donors means longevity of a transplant organ. So the longer transplant organ keeps going, of course, the more the better quality of life of the patient. And actually this is the main thing patients are concerned, that is about keeping their transplant organ as long as possible. Then there is an important issue of education and information, which should also include specific strategies for minorities, because they quite often drop off the bandwagon because of lack of information or cultural barriers. So this should specifically be addressed. The countries should learn from each other. I think that is obvious. And finally, patients are key partners to trigger action. And ultimately, we think that it is very important to stress what also already was stressed by Mrs. Woutmans, that this is the time to develop a new EU action plan on organ donation and transplantation, where we can stand on the shoulders of the previous one, but where we can bring the issue of organ transplantation one step or several steps further from where we are standing right now. This is what I wanted to tell you. I thank you for your attention.
Excellent. Thank you very much for that very extensive overview. And I was interested to note that amongst all of the transplanted organs, by far the most commonly transplanted organs is in fact kidneys, if I've understood the data flow correctly. And for our participants, we will make sure that all of the materials, including that presentation, are available on the website of ECHA afterwards. So you'll be able to download the PowerPoint and use it yourself and look at the detailed materials. We're now going to move on to a panel discussion where we're going to explore what are the challenges and the barriers that would be stopping us from increasing the numbers. And we heard there's some good news. In some countries, there's been an increase of 20% over the last 10 years, and in other countries, there's been a drop. So there's obviously some work that needs to be done here, and we can share experience and understand what are the different issues at different levels. So if we could just have this slide to show my panel members so that I can introduce them. If you look at the program, okay, so let me take you through. And first of all, we are absolutely delighted to have Mirela Busic on the line from the Ministry of Health of Croatia, representing the EU presidency at this time. We also have Dr. Gabriel Onescu from the European Society for Organ Transplantation. We also have Ingrida Pushinskaita-Kubik, I hope I've pronounced that correctly, from the European Commission in the unit dealing with substances of human origin, which is obviously the area that is around human organs and transplants. We have Dr. Viander Stel from the ERA EDTA Registry and the EDIS project. We have Daniel Gallego from the European Kidneys Patients Federation, so you'll be sharing also some patients' insights. And we have Dr. Beatriz Dominguez Gil from the National Transplant Organization from Spain. And Fiona, of course, you will be coming back throughout our conversation, sharing some of your insights from the UK and from a patient perspective. So the first topic we're going to look at is we're going to explore this issue of education and training. It came out in what Ray was saying earlier, the need for education as a driver to improve the rates of organ donation and transplantation. So the first question I'm going to ask to our our panelists is, who should we be reaching? Which stakeholders do we need to reach, and how do we do that? Let me start with Mirela to give us a vision across Europe at European level. Education, how do we get more people aware of this, and how do we train people to deal with it? Mirela.
I'm here. I'm happy to be with you and join this European Kidney Health Alliance forum. I would like first thank you to Professor Van Holder for huge amount of work done in preparation of these documents and joint statement. And I think it's a really valuable contribution to all of us, and it's a really great example how this partnership and a collaboration among health authorities, professional societies, and NGOs should work in future. So not only, but also can be then shown in a field of training, which is the topic of our interest at the moment. So I'm happy to share maybe some lessons learned in Croatia from the national effort in optimizing disease organ donation and transplantation. It's just maybe a few remarks on the Croatian transplant program that has been greatly challenged 2 decades ago by the patient's limited access to organ transplantation therapy. However, Ministry of Health launched a set of reports that happily resulted in an improvement in this field. So nowadays, Croatia is among the countries with the highest capacity in terms of provision of organ donation and transplantation services, which we saw in the graphs that were shown by Professor Van Holder. So along the Spain, Netherlands, Portugal, probably we can all state that training and education is one of the key efforts that should be done in optimizing organ donation rate at least. So training should be provided at all levels. So we can divide it on training and education for community, but what we suggest is at the first stage focusing on training provided to professionals working in this specific field in organ donation and transplantation as well. So engaging professional society in strengthening the competencies in the area of disease organ donation would be, I think, first priority. How we can collaborate in this field. So I think we should engage not only professional society at national level, but we should engage professional society, for example, those relevant for organ donation, such as critical care society, neurology, palliative care society, in collaborating at common EU level, aiming in developing guidelines and harmonizing professional code of practice in the field of organ donation to facilitate implementation and full integration of disease organ donation practice in the end-of-life care. Second, they should collaborate in developing training program and harmonizing curricula and catalog of competencies of health professionals involved in disease organ donation at national as well European level. And also developing open source educational platform to facilitate and promote best practice and strengthen clinical leadership competencies at national and European level. And finally, in developing framework for a common quality system to enable us to monitor hospitals or country performance and benchmarking the best practice in disease organ donation. And just few words, if we're talking about the education of public, we all know that traditionally transplantation and transfusion medicine field have a common root in the act of altruistic voluntary donation. Thus, in those countries where such act of altruistic human donation, organ donation, or blood tissue and cell donation is highly appreciated and perceived as a valuable contribution to the community, the culture of altruistic donation can be more easily nourished. So the recommendation from, at least from our experience and lessons learned in Croatia, would be to aim in common or harmonized school curricula in collaboration with ministries of education, etc. And thank you very much.
Thank you very much, Mirella. And you've noted the importance of, education at all level and building towards this culture of altruistic donation. So I'm now going to turn to Beatrice to hear the experience from Spain. But before I do, let me encourage the participants who are listening, at any time you're welcome to submit a comment or a question using the Q&A function, which you'll find in the toolbar at the bottom of your screen. And there's also the chat function where you can send us a message. So feel free if you've got a question or you want more clarification. So Beatrice, how is Spain such a standout? Because if you looked at the slide that Ray showed us, Spain is way above everyone else in terms of the number of donors. So clearly there is a culture of altruistic donation that Mirella spoke about that already exists in Spain. What can you tell us about the education and training of the public? How do people have such strong support for donation in Spain?
Well, first of all, thank you very much for this forum. And please allow me very shortly to send a message of support to all those healthcare professionals who are dealing with the coronavirus situation, which is really of high concern for many countries, and now particularly also for Spain. So a big support to all those healthcare professionals. So dealing with the issue of donation and transplantation, education and training per se is a fundamental issue. Regarding professional training, in our experience, we could say that it's never enough. So it's a fundamental element that authorities take responsibility in ensuring professional training. If professionals are convinced, the society follows. So that's a very important issue. Among those professionals who we have been training over the years, we talk about donor coordinators, We talk about critical care professionals, intensive care professionals, professionals working in emergency care. As Dr. Busik said, in close cooperation with the relevant professional societies and other professionals who indirectly participate in the process, for example, coroners and judges. It's important to say that in Spain, the government has taken responsibility in this professional training. So every year we devote governmental funds to the training of these professionals. Of course, professional societies contribute, but we don't rely on professional societies. There are governmental funds devoted to ensure the appropriate training of all those professionals who participate in the process, because we believe that is a responsibility of the government, of the state. This also applies to the different phases of the process. And of course, a critical one may be the communication with relatives at a very sensitive and a very complex moment, which is the loss of a beloved family member. And to us there, the training remains critical. We have seen that the position of the Spanish society towards donation is positive, but it's not better than the one in Germany or in Nordic countries or in the UK. So as a natural situation, people are prone to donate as much as in other countries. What we believe makes the difference is the family approach and how our professionals deal with those families and present the opportunity to donate at that particular moment. So we make great effort in training all professionals who may participate in the communication with the family. Once again, not only donor coordinators, but all professionals who deal with critical care patients. So training, training, and training. In addition, besides of what Dr. Busik previously said, we need to reach the public. But I think we need to take advantage of the fact that to the mass media, donation and transplantation is a very attractive topic. So what we have done in Spain is not to make big promotional campaigns or invest money in making promotional activities. What we have tried to do is to build a very good relationship and a solid relationship with the mass media, and they have progressively become true allies in promoting donation and transplantation of ONT and of the Spanish government. So our advice would be to put funds and efforts in professional training, all professionals, and secondly, to work very closely with the mass media. Those to us are the key stakeholders. Thank you for the opportunity.
Thank you very much, Beatrice. Let me turn now to Gabriel Oniscu from the European Society for Organ Transplantation. We've heard there from two different perspectives from both Croatia and from Spain, and they've emphasized the importance both of training professionals who are on the frontline clinical environments in the intensive care and emergency departments, the importance as well of communication with families and building up a positive relationship with the media, so this is publicly spoken about. What else would you like to add in this issue of education and training?
Thank you. I think the key points were actually made by Fiona and Ray, really. And for our participants, I'll highlight that point was the wrong advice that Fiona got early in her disease. So clearly that highlights 2 points. The patients need to be aware and the professionals need to be aware. And then obviously Ray talked on a slide quite a long time talking about the variation in practice, which is sometimes tenfold. So this is where ESOT really comes in, because it's the hub of all health professionals involved in transplantation in Europe. And as such is a platform to share experience, knowledge, and lead to benchmarking, which is a point that Mireia also made, that it's important in terms of education. I would see education at 3 levels, really. First and foremost, it's patients, and they need to be aware of all the treatment options and pros and benefits of each of the options. And this is where also ESOT has taken a huge amount of put a huge amount of effort trying to build links with the patients' associations to try and improve the link between the professionals and the patients, to try and educate both sides about what options there are and how they can be done. I think the public, it's been very well covered by Beatrice, and I think one key point I would make is that we need to have sustained publicity campaigns with correct information that allows people access to what is important in Europe, not from elsewhere, and what is relevant to ensure that we minimize the variation in practice, we minimize the inequity in access, because it doesn't matter where you live in Europe, you need to have access to similar treatment options. And again, here where we come from an ESOT point of view, we've taken a huge amount of time, and we build an educational platform. We're building a registry of specialists where other health professionals in Europe can interact with and provide and gain experience from colleagues in other parts of Europe. I think that's an important point, because we need to break the boundaries, we need to break the barriers, and create a focus on education and training and correct information dissemination, which will eventually lead to benchmarking and equal outcomes throughout Europe.
Thank you, Gabrielle. And you, I think, very correctly pointed us to the key challenge and opportunity that exists at European level, which is this opportunity to benchmark and then see these enormous differences, the tenfold differences between the countries that have the highest levels of transplantation and the ones that have the lowest level. And that that graph shows us inequity of access to care and then inequity in the treatment that people receive. And this is obviously got to be a core focus that we need to pick up on.
But Tamsin, if I make one point here, I think, yes, those differences do exist. And I think what we need to do is to encourage people to appreciate those differences and not see them as a stick. It's not pointing the bad. It's actually getting everyone to work together to get to the right level of experience. So the whole idea of benchmarking, it's not necessarily telling someone they're doing the wrong thing. It's actually helping them deliver the best practice.
Okay, so it's not a name and shame. It's showing the potential that people could reach as they move up towards the higher levels. Thank you for reframing that for us in that context. Fiona, let me ask if you'd like to come in here, because you will put yourself down on the donor list as a potential donor way before you knew you might need it. So as an 18-year-old, clearly education had reached you at that point. But as someone who's now worked for many years in this area, where do you see we could get the best value for our education and training efforts?
Sorry, I had myself on mute. I think reflective of some of the things that the others have said, the point I was going to come in was on patient leadership. So I think that the charities, the foundations, the associations have a big place to play in this, provided we can jointly produce the best and most accurate information that reaches people. So my point is really about collaboration. I think where we've seen the best results so far has been where patient organizations and medical organizations have worked together to be able to say, we all believe this is the right thing to do, but we can, between us, reach different groups, if you like. And I also very much take up what Beatrice said earlier about working with the media as well, because they do like those stories. So actually being able to empower individual patients to support them to be able to tell their stories, because that helps other people understand what the difference is there. And finally, I'd just like to talk, semi-finally, about schools as well. So I think if we talked about education, but actually young people can be the change makers. So having them well informed through the school curriculum, whether it's universities or whether it's towards senior school as well, to understand what those programs mean. And that's something that can happen across Europe. The EU can perhaps support as well. But the point is that we can always gain more success if we do it together.
Okay, thank you. And just as a reminder to our participants who are listening, you are welcome to submit a question, a comment, or anything else via the Q&A function or the chat function, which you'll find at the bottom of your screen underneath the image that you can see. We've talked now about education and training, and are now going to move to the next topic, where we're going to look at how the national programs for organ transplants operate, and what are the key success factors. Now, what we can already understand, obviously, you've got is the national transplant coordinators and their leadership role. If you've got an active, high-performing national coordinator, you would expect the whole program to be making momentum. But also, you've got to have the political will behind it. You've got to have this as a clear and goal and priority for the ministers and the ministries themselves. There's also the fact that it's the legal and institutional framework that's got to be supportive. Fiona, you was celebrating that in this year, it will be an opt-out system rather than opt-in, and that this makes a huge difference to the process of getting people on the transplant list access to organs. We also talked about, the importance of educating people and through the media so people understood it, and so that the communication can take place at what is a very challenging time for families. If somebody from their family has experienced an accident or is dying in the hospital, this is a hard time to have that conversation. So these are some of the elements that we already know would work well in the national programs. Let me come back to you, Dr. Busic from Croatia. What elements do you think we could learn from and build on at national level? Mirel, I think you're still on mute.
Yes, I'm here.
Excellent.
I heard your question. So, Croatian experience, what we can say, Croatian transplant program is governed, coordinated and overseen by the Ministry of Health directly since 2000 today. We were facing, it was good for several reasons, and it resulted finally with improvement and boosting donor rate and transplantation program. However, there are certain obstacles why it is not the optimal model, and transplant organization maybe can serve better. However, this is also a good example how Ministry of Health, when is accountable for organ donation and transplantation, can really make remarkable progress and change. So that means that there is a political will, that proper funding is assured, and then that all those organizational measures can be easily implemented in the system. So there are a lot of advantages as well when Ministry of Health is coordinating directly the program. But however, the backbone of the Croatian transplant program are the key donation person, which means hospital-based capacities in ICU directly that are responsible for organ donation, disease organ donation pathway, and to address all these critical steps from timely identification of each possible donor till procurement and procurement of organs. So the key message would be that ministries of health or health authorities should be responsible and should place the organ donation and transplantation at a daily political agenda, and make it as a strategic priority in the health policy, and provide and support with proper funding, training, and other organizational measures, professionals working in ICU, critical care, and all those working in the field. This is what we did, and what I can say about Croatian model.
Okay, lovely, thank you. Let me turn to Beatrice. You told earlier a little bit about how things work in Spain, and you emphasized that the government allocates money every year to education and training, so you can see that it's clearly a political priority and an operational activity that happens every year. given that Spain is the country that has already the greatest number of transplants, you're obviously doing well. What more should be done in Spain? And do you see other countries contacting Spain and saying, hey, how can we learn from your model?
Thank you for the question. We are convinced that improvement is always possible. And it is required because actually we know that the transplantation needs of the population are going to increase over time as something inherent to the aging of the population, particularly in the field of kidney transplantation. And we also know that the pool of potential donors is declining because of the fortunate decrease in mortality related to transport accidents or cerebrovascular diseases. We also know that end-of-life care practices are changing in Europe, and we have evidence that persons are dying in very specific conditions in our ICUs, which makes donation after circulatory death imperative in Europe. However, in many countries, this is still not a reality. So we have somehow in Spain understood this early, and we are trying to continuously adapt to this changing scenario. So our areas for improvement are very well established, and of course we share them with all countries that contact us. And these are related first to the identification of opportunities of organ donation, not only in the ICU, but in the entire hospital. Donation should be something normal in all areas of the hospital besides the ICU. So the engagement of intensive care professionals and the emergency care professionals, for example, is essential. So that's a first thing. And this is, however, ignored in many countries, and there is a huge room for improvement there. Secondly, we know that there is a limited use or a difficult use of organs from aged or very aged donors. However, our potential donors are and are going to be aged or very aged individuals. So in Spain, we're making efforts to better learn to properly use organs from aged individuals. And once again, this is a big area for improvement in Europe. Third, donation after circulatory death, as I mentioned before, has been a priority in Spain as well. We have increased by 40% donation rates in 6 years, thanks to donation after circulatory death. However, in many European countries, this is still not possible because the legal framework has not been developed, because it is even prohibited, or because the framework for the practice has not been developed. We're working on it, and as I said before, this has been a complete revolution for donation and transplantation in our country. Fourth, although a minor issue, a minor in terms of numbers, not of importance, we're working on pediatric donation. The death of a child is something unnatural and of course exceptional. But when it happens, we need those organs to be offered for transplantation, and we need to prepare to properly use organs, which sometimes is, from the technical point of view, a challenge. Besides, we know that that family will be not relieved, but it will be helped in a very difficult, impossible to imagine moment for them. So we are working on those lines because we still know that improvement is possible. And besides, we are convinced that every person who dies or is about to die in conditions consistent with organ donation should be given the opportunity to donate, not only because of patients on the waiting list who are the leitmotif of organ donation, but because many people really wish to contribute to organ donation. So it may be considered in the overall best benefit of those individuals to offer them the chance to donate. We're working on this, and of course we share all our knowledge and experience with all countries in the world, and of course we learn from them as well. We learned DCD from the UK and from the Netherlands, so we can learn from one another, as previously said.
Excellent. Thank you for that. And you've given us some good suggestions about, the revolution you talked about, which is which had increased donations by 40% in 6 years. That's extraordinary, and clearly there's something there that needs to be picked up and used across Europe. So let me now turn to Ingrida from the European Commission, because you very much have the bird's eye view across all of the different EU countries. And we've heard 2 examples from Croatia and Spain about how they think they've managed to succeed in developing and growing their program further. What's the view from Brussels and the EU looking at what could be done to improve the way the national programs work? Ingrida.
Thank you very much for the opportunity to join for this webinar. And before I mention a few points that I wanted, let me just express appreciation with the collaboration that we had with the stakeholders, and in particular with the ECA thematic network leader, also ESOT on a number of projects, and then their participation in the National Competent Authority, also the EDIT project, one of the pilot projects that we currently follow. And also, last but not least, with Croatian Health Ministry for the preparation of the Council presidency, and also the Spanish National Transplant Organization, ONT. Having said that, could I ask maybe to put the slide that I prepared for my, yes, thank you. So what I wanted to mention is the following few points. I think it's important to stress that in general, like overall, our role, the Commission's role, or the EU role in the field, is clearly determined. So healthcare, it does remain the competence of the member states, and that limits our EU role to complementing the national policies and fostering the cooperation between the member states. It was already mentioned by a few panelists, also by MEP Woutman. We do have the legislation at the EU level, organs legislation, which sets the high standards for safety and quality of substance of human origins, of organs. And while one might consider that this mandate has its limitations, as we know, the EU member states under rotating European presidencies, so Spain in 2010, Cyprus 2011, Poland 2012, they did highlight the importance of the EU-level collaboration in the field of transplantation. Now, the current presidency, Croatian presidency, also highlighted transplantation as one of its priorities. What we recently did, well, when I say recently, in the last years, 2009, 2011, the EU Action Plan on Organ Donation Transplantation, it did set clear and common agenda on how to increase the transplant activities in the member states. So here you have on the left-hand side the objectives, but also the 10 priority actions. It was already elaborated in the previous interventions that we did have the calls to increase the organ availability, make transplant systems more efficient, accessible, improve quality and safety. Having this purpose in mind, and having worked on the EU Action Plan, and implementing the EU Action Plan 2009-2015, with this purpose in mind, there were more than 20 different EU-funded actions organized at the EU level. Maybe I just mentioned the recent 2, which are important, and one of them is still ongoing. One has recently finished. So much of this work is taken forward. The 2 pilot projects that you mentioned, which were proposed by the European Parliament, one focusing on training and awareness building, EU Donor Organ project, and another one which is still ongoing, which focuses on the organization of kidney transplants, the ongoing EDIT project. I think this project is very important, and we might later hear also from other panelists more about the project. The project is important because it's about rolling out a self-sustaining European living donor registry inter alia. Now, we do acknowledge here in the DG Santé team, but also in the European Commission overall, that further action would be helpful to generate some supplementary boost in activity in the field. In terms of the recent developments and our concrete plans, what I should mention is that we did recently finalize the evaluation of the blood and tissues and cells legislation. So the two fields are related adjacent fields to organ fields. So these are the part of our substances of human origin field. And it was the first ever evaluation since the adoption of the Basic Acts in 2002 and 2004 for blood and tissues and cells. Now we do have the legislation for organs dating from 2010, slightly well, less old, if I might put like this. But this is just to mention that we will be, and we are following down the outcomes of this blood, tissues, and cells evaluation. And why it is important to mention that, because in the course of the blood, tissues, and cells evaluation, the large majority of the stakeholders submitted to us the challenges that they see. And those challenges, some of them, they are relevant also for the organs field. Let me just mention the donor protection, vigilance, innovation, sustainability. To summarize, I would like to mention that we do consider a possibility to work on horizontal SOHO actions, which would include also organs. And we see that we should better explore the synergies in those fields, in blood, tissues, and cells in particular. And that would then enable us to pave further the way for the collaboration also for the member states at the national level. So these are the points that I wanted to mention at this point. Thanks.
Okay, thank you very much for sharing some of this. And this slide that you've got up here, I think is quite important because it indicates the things that are outside the scope of the directive, but which are things I'm sure that people are concerned about in different countries, like the waiting lists or the allocations of health systems and resources. Quite naturally, people would want to see those things change, but they're not within the framework of what can be done at European level. So we have limits to what can be done, but you've described some of the key areas where there is a benefit. And MEP Woutman at the beginning asked the question, is our legislative framework appropriate? Is it fit for the way that the transplantations need to change? So I see that we've got a question or a comment that's already come in, and I will pick that up perhaps a little bit later, but thank you for sending the question. And I remind everyone that you're welcome to send a comment or a question, and we'll pick it up at this sort of, when we finish this first set of issues I wanted to talk about. So let me move now to the third topic we wanted to address, and that's the health economic aspects. So the good news here, transplants save lives and they cut healthcare costs. So that's a win-win. But we've heard there is a gap, there's not enough donors, and that there isn't the capacity in some of our health systems to actually carry out transplants, because transplants themselves are very intensive in terms of the resources and the specialists that they need. So how do we help the different countries across Europe devote more resources within their healthcare systems to transplants? Because in theory, the evidence is there. They save lives and it's cheaper over the long term. But of course, you probably have to invest upfront in some other activities. Let me start with you, Ingrida, and I'm sure other members of the panel may want to come in on this. Notoriously, ministers they don't have an endless magic pot of money when it comes to their health systems. But there is an endless need, source of demand, and healthcare costs are going up. You've mentioned that we've got an aging population. Ingrida, do health systems in Europe have a clear consensus on understanding that transplants are a money-saving and health-saving activity and they need for further investment? Or do we still need to make that case?
Thank you. Indeed, this is the core, I would say, of this discussion, of this block of our panel discussion. Because when we talk about the health economic aspects as such, I think we have to first remind ourselves that non-communicable diseases impose a substantial burden on healthcare systems, and also it does have an impact on an economy overall. I would like to pick an important finding which was included in the ECHA joint statement rationale, which accompanied the joint statement as such, the evidence-based scientific annex. And there we could read, for us it's black on white. I mean, it does represent the case. It basically refers to the kidney replacement therapy population. On the one hand, it represents only 0.1% of the general population, but on the other hand, it does consume at least 2% of healthcare expenditures, and with some estimates referring to 5 to 6. So this is just to say that there are huge saving potentials there if we consider the organ transplantation field, and if we try to really enable the systems to get the best out of that. And having said that, what we know is also the NHSBT study. It might be considered relatively outdated because it dates from 2009, but already at that time it was made clear that the kidney transplantation is by far the most cost-effective replacement therapy option, particularly after the first year of surgery. And this owes to a combination of prolonged survival, improved quality of life, and reduced net expenses for therapy per se, and reducing costs by at least 60, in some cases 80%. And apologize. And in this context, I would like to mention our pilot project that we follow, the EDIT project. This is the EU-funded project on effect of different kidney disease treatment modalities and organ donation and transplantation practices and health expenditure and patient outcomes. So this project, EDIT project, is aimed at addressing the most challenging differences and providing recommendations for improvements for the member states, for the authorities, for the health, for the ministries, and the results will be submitted very soon. So we will see their updated calculations, the state of play for today. So just to mention also that we know that much can be achieved with organization, education, motivation, leadership, and communication. But of course, funding is also essential for sustainable outcomes, as it remains the key issue for improving national transplantation programs, research, registers, and data. I think what we have to all be aware that rather than focusing exclusively on increasing the transplantation rate, we have to place a great attention on fostering quality and enduring outcomes, and that entails the multi-level and multi-stakeholder effort. So we do have the data, we do have the scientific papers. We will soon have the EDIT results, and there is then the role of the national politicians to make the right choices and then to update their national action plans in organ donation transplantation and implement them in the most efficient manner.
Okay, thank you.
I'm curious to hear what the other participants find.
And now I'm going to open this up to other members of the panel. When we say invest in transplant capacity, help me to understand, what is the big barrier? What's the big block? Because at the beginning, I assumed it was the lack of donors. If we've got 134,000 people on the transplant list, and people are essentially dying before organs become available to them, I'd assumed that that was the big block in the transplant capacity. But and that obviously we've talked about education and training and public awareness. But if we're looking at the health system, are there other areas that we need to invest in that would be a block that could be addressed? So if suddenly we managed to do what Spain's managed to do and increase the number of donors by 40% in 6 years, do we have the capacity within the health system to process that and manage that? Does any one of our panel members want to say something?
Tamsin, I'll
Gabrielle,
take this first,
yeah, okay.
if I don't mind. As a surgeon, we acutely looking at this, and certainly, as Fiona has expressed earlier on, we're looking at legislative changes in the UK, and there is an estimate increase in hundreds of transplants. Now, in order to do this, and it's not a UK unique situation, it's across Europe, someone needs to do those transplants in purpose-built facilities. So you need to build infrastructure, and you need to invest in education and training of the new generation of surgeons and health professionals in transplantation. You also need to invest in new technologies, because the donation process is sometimes laborious. Transplantation often takes place at night, which is not particularly inducive for the health of health professionals. It comes with higher risks. So we really need to consider that sort of infrastructure before we consider everything else in terms of increasing donation. And I would be interested in Beatrice's views, because certainly Spain has seen an increase in donation. As how do they manage to do that when the rest of the countries in Europe, at various speeds and various levels of development of their transplant programs, will face the same issues? But my view is to invest in infrastructure and train the health professionals to undertake those transplants that will come our way.
Okay, thank you. Beatrice, do you want to add to that?
Well, certainly I think I need to share our experience with you, because it has been also very challenging to be able to do all those transplants once you have those organs available. And I'm aware in many countries, we have seen that increase in donation and transplantation. And as Dr. Oniscu was stating before, you need to have those professionals available, those professionals with capacity. And we have had some units which have increased their number of transplants by 50 or 100 a year.
Okay, that's huge.
So, you really need to reinforce this structure if you want to be able to tackle this. And I have to tell you, regrettably, that while this donation was increasing in Spain, we saw a decrease in live kidney transplantation. And the reason for this is that the teams basically didn't have the capacity to handle all those transplants. So we need to constantly evaluate, as the activity increases, our capacity to properly perform those transplants. And as Ingrida was saying before, we have to do them, and we have to do them with good results. And this needs education, this needs professionals with capacity and with availability. It's a challenge, and we are working with the health authorities to ensure a proper reinforcement of the system. But it is actually one of the main challenges in Spain, ensuring the sustainability of the transplantation system. Now that I have the word, I just wanted to add an additional comment on what Ingrida said about the less cost of kidney transplantation compared to dialysis starting after the first year. There are different studies which assess this is the case even when we use standard criteria donors. So even for expanded criteria donors, this is always the case. You save money with transplantation compared to dialysis. And I wanted to say that end-stage renal disease patients represent in Spain 0.3% of the population, but they use more than 3% of the healthcare resources. So that's also a very important component in order to ensure an appropriate funding of the transplantation system. Well, just to complete that information in cases of any use. Thank you.
Great, thank you. Vianda, I think you wanted to come in on this.
Yes, I can add on that because as a result of the EDIT project, which was mentioned a couple of times by Ingrida and Raymond van Holder, we performed an EDIT nephrology survey, so a survey among nephrologists within Europe. And what we found in that survey, we asked about the barriers they experience when providing renal replacement therapy to their patients, in that the barriers were different for those countries or centers who had kidney transplantation or those who were just developing it. And although the lack of donors was the main barrier, we also saw that for those countries where there was no kidney transplantation available, the financial issues were the largest barrier. But for those who had kidney transplantation already available, there were no really financial issues, because it had more to do with the patient itself, if it was possible, yes or no. And also the nephrologist said that it was the attitude or the knowledge of the patient. So we really saw different barriers across Europe, which I think was an interesting finding from the EDIT project.
Okay, thank you. Ingrida, I'll give you the last word on this topic before we move on, because we've had a question from one of the participants, and they've correctly noted that in the joint statement, it calls for an effective tapping of different EU funds, structural funds, and other investment funds to be used to increase the capacity of healthcare systems. And one of our participants has asked, do we know how many countries are actually doing this, using their EU fund allocations to be able to do this? So maybe you have an answer to that, Ingrida.
So indeed, this question is very complex because we have a variety of budgetary lines, and in DG Research, Directorate General Research, here in DG Santé, so different packages where we possibly can allocate to implement those projects. So I don't have a complete picture of how many countries and who use that. I don't have, but what I could maybe mention, just refer, just mentioned the SRSS, the program where, to my knowledge, to our knowledge, a few member states consider requesting the support, and not necessarily for organs field, but also for other SOHO fields. So here in DG Santé, we have an overview of the running projects, of the EU-funded projects, the pilot projects that come from the European Parliament. So we do manage those. In short, I cannot provide the overall answer for the Commission, like how many member states and what exactly the projects. But if this information is relevant, we could try to gather data.
But just and I don't want to get too specific into the complexities about the way the different EU budget lines work, but looking at the country-specific recommendations, which is where the European Commission gives feedback to member states on how they're planning to spend their money. Has there been any country-specific recommendations that pick up on this idea of the importance of investing in the capacity of health systems to manage transplantations? Because our earlier speakers have said, you know, we're getting older as a population. By 2030, Europe will be the oldest continent in the world. So our need for transplants is going to go up. So here's my question for you. Do you know whether this has been included in the CSRs, the country-specific recommendations?
I would not speculate on answering that, not having the detailed information. So yes, I cannot provide you with this answer.
Okay, that's a topic for us to maybe pick up in a follow-up series of information. Let me now move to the fourth element in our panel conversation, and we've already had some participants who said, hey, let's find out more about this EDIS project. Well, here's where we're going to be passing the floor directly to Viander Stel, who is going to give us some insight into the findings of the EDIS project. We've been eagerly awaiting them. They've been referred to already by several other speakers. Viander, tell us more.
Well, thank you that I can join this webinar. And this EDIS project was not possible without the EU, the European Commission, but also the European Kidney Health Alliance. So also thankful for making this project possible. Yes, the EDIS project, it has several aims, but one of the aims is indeed to development of European-wide registries based or in relation to kidney disease. I think that's the part we would like to talk about now, and I think further in the webinar I can talk about some other aims we had in the project. But if we talk about data registration, the first part, there were 2 registries developed within the EDIS project. And the first one was the European Living Donor Registry. And this registry is about those patients, or those persons, I should say, who donate kidney. And although there were some national initiatives on that, EDIS project succeeded to make a European-wide registry, at least the development of that. So now some countries are entering their data, and it is just the beginning, but I think the governance structure is there, and it is indeed possible to provide data at the moment. Another registry, which was developed during the EDIS project, was the European Kidney Recipient Follow-up Registry. So this registry is more about the transplant data set and also about the donor kidney details. And again, there were also some already national and also some European initiatives on this, but now it's more, they would like really to have a European registry. And also here, there are now several countries contributing data to this registry. It's an important step because now there is much more collaboration within Europe. And I think that the good news is maybe Gabriel and Nisku can tell us more about it, but as far as I know, the ESOT has formally announced to be interested to take care of these 2 registries. And I think that's really important because we already put a lot of effort to develop this. But of course now in the future it's important that someone take care of them and that there is a continuation in this. And if I see EDIS project, it's not me that's all doing this work. So for the European Living Donor Registry, it is IDIBABS from Spain who was working on that, and the National Transplant Center in the Netherlands. And for the Kidney Transplant Registry, it was Eurotransplant from the Netherlands, and it was NHST from the UK who did important work. Okay. And then we can talk about the future. Okay, maybe it's enough for now. Yeah.
Maybe you could just let us know the EDIS project. When are the is it finished? When will it finish? When will the final results be out? And where can people find this information?
Yeah, well, this was only a part of the EDIS project, is the EU-wide registries. The project was expanded, so the end of the project will be in June of this year. So all the results, I guess, will be available, all the deliverables, half of this year or maybe a little bit later, but it will be available.
Okay.
The other part of the project, probably it's good to mention, it's not only about registries, which was an important part. There is also an important part, it's about how to improve the optimal care for patients with end-stage kidney disease. Because for most patients, kidney transplantation is the best option, but you can also imagine if you are not healthy enough to get a kidney transplant, also several dialysis modalities could be the most optimal treatment, or even conservative care. So part of the project was also dealing with what is the optimal treatment for patients and what are the barriers. Why could not all patients in Europe get the optimal treatment? And we really found that this was really different across Europe. So for instance, if you look at countries with a lower GDP, they experience much more barriers than countries with a higher GDP, and also sometimes different barriers. So one of the main conclusions of the project will also be, which is also a joint statement, that you could not have one policy in Europe. You should really learn from each other, the countries, and then improve what works for your country. And then also, in relation to what Ingrida Punsinskate said already, we did an analysis also on the costs. And I think that's also an important deliverable of the EDIS project. What are the costs of kidney transplantation and dialysis in Europe in the different countries? And also, again, you see large differences. And you can imagine that if kidney transplantation is more expensive in your country, it's probably also more difficult to improve that.
Okay, thank you. It sounds like it's EDIS was a pilot project. Is that correct, from the European Parliament?
Yeah.
Is that right? Yeah, excellent. Well, it sounds like
probably Ingrida can say more about it. It's called pilot project, yeah, but I'm not really sure what the word pilot probably means here.
Yes, maybe maybe I just could add something already what Vianda nicely summarized. So there was I understand a question as regards EDIT, when we can expect the publication of results, and can you share some preliminary results? So Vianda already mentioned a few elements. Just 2 points to make in terms of the results. I mean, for us, the important is in terms of confirming the economics, as we already discussed. So organ transplantation does offer significant savings compared to dialysis, so that will come out. And in terms of the practical follow-up, publication, and the state of play of the project for the moment. So there will be a so-called final meeting very soon, where all the parties that worked on this project together will come and then finalize the outcome, the deliverables. Then we as the Commission, we will publish those results. In terms of the timing, I will not give you the precise date. So the results will be also discussed at the National Competence Authority for Organs that we want to have in April. And later, of course, there will be a question in terms of the sustainability of the project. And as Vianda already mentioned, there are very good ideas coming forward of how to make this, what has been generated, the EU funding, that the project is sustainable, so that the kidney registries that they will be being used, and then basically that those participating in the registry could benefit. So the publication will be this year, and so the results will be available to those interested.
Excellent, thank you. And we'll make sure that everyone who joined this webinar will get the link to the project, so they can keep an eye on the website itself later in the year. Let me now turn to Gabrielle Aniscu, because we've had a question in from one of our participants that I think you can pick up on in your comments, because we were going to ask you, how can the work of an organization like yours contribute, and what kind of support is needed? And the question we got from the audience is, what are the best tools to increase the living donor pool in a country? And I'm sure that's an area where your organization has got lots of insights. So Gabrielle, the floor is yours.
Thank you. I'll start with the question first, and then I'll come back to the EDIS and the registries, because it's an important thing. So I think living donation has taken different routes in many countries, and of course, we need to be sensitive to the local customs, local society approach to donation, and to how it's perceived in there. I think the role of ESOT is very much to harmonize this, to create guidelines and highlight the benefits of living donation, but also what can we do and which potential patients we can take through a process of donation, because living donation is not without risks, and people understand that, but they do it because it's done in a safe way. So I think this is where we contribute. To me, one of the biggest tools is actually not necessarily promoting living donation, which is also important, but also going back to the recipients and making them aware of the fact that what are the benefits of transplantation, and the fact that if we do living donation, prior to dialysis, we're not only improving the best out, providing them with the best outcome, but also saving a huge amount of money to the society by no one seeing dialysis. And I think that's what's never been mentioned in this webinar, that we do not need to see dialysis prior to transplantation. And one of the approaches we need to promote is actually transplant first. I will pick up now on what Vianda was saying, and I think the important bit here is that EDIS has been very successful for a number of years, but if we do not continue it, it will just remain a pilot project, and all that great amount of work that's been done will be lost. Vianda mentioned that ESOT has taken an interest in the registries, and in fact, we are considering developing a pancreas transplant registry in Europe, because pancreas transplantation in Europe is probably more developed than anywhere else in the world at the moment. And we feel that registries such as EDIS or the pancreas or others have a number of roles to fulfill. And I think if we put the patients first, which we should always do, first of all, availability of data across Europe will provide an impetus towards equity of access for transplantation across the continent. Secondly, we'll benchmark the outcomes and will allow us to see where we are and what we can do to improve those outcomes across Europe, because there may be barriers, there may be issues in terms of training development, as we discussed for the last hour and a half, and that data will allow us to do so. It will also allow us to share good practice and develop guidelines across Europe, and the project that we discussed at the beginning with ECHA is very much aligned to those guidelines, to those ideas of actually what do we need to do to reach that stage. Even if we want to promote the registries as ESOT, we cannot do this alone, and I think we need to have a number of key partners in here, and first and foremost is buy-in from every country. Vianda's mentioned that a number of countries who are established in transplantation contribute data, but that's all great and good. But we also need everyone else who are at the beginning of their programs to buy in this and see it as a potential to develop their expertise when they see their results against the others. This is why I said at the beginning, this is not a stake, it's very much a way of increasing the programs and developing them. And also, key is we need support from the European Commission and the European Parliament. You know, there is a need for political will to support those registries. It doesn't matter if the patients or the professionals or other stakeholders want to make this happen. If there's no buy-in from the political power and also from each country, this will never happen. But if we start and continue it, I suspect it's like any movement. It will grow and eventually will become widespread across Europe, and people will realize the benefit of having those registries.
So you're quite ambitious there, Gabriel. You're planning to build a new movement across Europe.
Yes, it's a patients movement. It's an outcome movement. Call it any way you want, but I think we need to do this. I think if we don't do it, we'll fail miserably, and it's not the stakeholders, not the professionals who lose out, it's the patients, and we should not forget this, that we're here for patients, and if we don't do that, we may well just pack and go home now.
Okay. Well, you've given me a good opportunity to move to the last section that I wanted to cover in this panel, which is looking at the broader societal challenges. And you've highlighted the fact that there are huge inequalities across Europe in terms of access and treatment options. And some of the factors that are driving these inequalities include people's ethnicity, their educational level, their socioeconomic status, their health literacy, etc. So there's a huge amount of work that needs to be done. And I'm now going to open to members of the panel who want to pick up on the societal challenges that are there. And you know, Gabrielle, you said it's really important that we put the patient at the center. Let me invite Danny as one of our panel members and another patient expert to share their experience. So Daniel, would you like to go ahead? You need to unmute your microphone, Daniel.
Yes, sorry. My pleasure to be here representing European kidney patients' voice across Europe. So thank you very much to ECHA to join this webinar. Let me show you with some slides what we see with the European transplant in the registries or with the societal challenges. We barely see the tip of the iceberg. So we strongly believe that the key of the empowerment of people and societies is information. So you can imagine how important is the registry, and don't be and trust not only in belief and estimations, so in the data and the registry. We encourage to, please, next slide, the importance of data, not only in kidney transplant, even in all kidney disease. It is well known that you can read in the $1 note that in this famous quote, in God we trust. So for patients, we believe that it is more important in God we trust, but all others might bring data. So this is very important for us to go to the policymakers or to the institutions with data, with trustful information, and maybe we can build an online tool, a real-time to give the picture of the real-time patient journey and translate all the databases and to be able to have all the kidney patients in every renal replacement therapy or in every stage of chronic kidney disease across Europe. So we need to develop some guidelines and standards collection to evaluate, auditing, and benchmarking every data and facilitate this establishment in the EU-wide registries or a EU-wide collection and exchange of data. And next slide, please. Yes, as you can see, the chronic disease patient journey, we are candidate for one or more kidney transplant, especially if you are young. So in your lifetime, you will be on and in of the laboral market because the duration of the kidney transplant is more or less, the average is 12 years or 15 years. It depends of this from living donor or deceased donor. So as a society, we have to be able to protect this kind of situations because it is very important to create these programs to reincorporate people from the laboral market to the dialysis in their lives. Of course, we are claiming for some living donor leave equal as maternity leave or paternity leave to protect this potential donation and to protect this special situation. And of course, there is some inequalities in transplantation to access to the waiting list or to access to the protocol to be on the waiting list, the duration of this kind of procedures. So we need to spread on Europe this awareness about the social protection of the people, especially when people are young, to facilitate to be in the society as an equal. Now, this is all about dignity, to have the same research, the same options, to be to have the same hopes, of course, dreams, and to have a fulfilling life despite your health.
Okay. Thank you, Daniel, for sharing these viewpoints from some of the societal challenges. I'm going to come to Fiona in a minute, but to also give a viewpoint from patients. But before I do that, we had a question from a participant, which reflects something that you said, Daniel, because the question we had was, how about the social protection for the living donors? Daniel, you've made a call for it to be considered a special type of leave, like maternity leave, parental leave, a sort of carer's leave. We should have an equivalent protection in law for living donors. And Gabrielle, I know that you wanted to make a comment on this. Gabrielle.
Thank you for putting me under the spot there. I think it's an important thing. I think living donation has to be recognized in society as a very valuable asset. And throughout Europe, no living donor should be out of pocket. I mean, a lot of discussions at the moment are about reimbursement, about costs, and so on. And I think there are a number of ways that can be provided by, but of course it varies from country to country. But essentially, reimbursement of cost and lost income has to be there. Health insurance has to be there. There should not be any barriers in securing health insurance and employment and everything else. So we need to support living donors, and also have to provide long-term care, because we are not quite entirely sure about the long-term implications of donation. There are clearly publications suggesting a slightly higher risk for long-term, but that risk remains low. And I think that's what we need to get out there to the public, that donation is safe, but people have to be comfortable that we have all the mechanisms in place to support them through the remaining of their life, which for some people is quite a long period.
Okay, thank you. Fiona, let me invite you to now signal anything, flag up for us, any societal challenges in this broader kind of ethics area that we should be exploring.
Thank you. Thanks very much. And I would just like to back up what Gabriel just said about supporting living donors, because across different parts of the countries, not everybody is supported in the same way. And it also depends on the employer as to whether they choose to pay the full wage during the time the donor is off. So those are absolutely things we need to look at, because living donors are very precious. So a few things I'd like to make a point on. One is about support and information for minorities. In this era of fake news, sometimes when we talk about organ donation, not everybody understands what that means. And so it's incredibly important that culturally sensitive messages are promoted, co-produced with people in the different groups, and promoted everywhere, so that people can understand that this is something that is beneficial, but it is not about the government coming in to steal someone's organs. And I think it's really important across the whole patch that we recognise that is a challenge at the moment, and that we can work together to do that. Secondly, I'd like to just go back a little bit to some of the other challenges around how we support donor families as well. So we talked earlier about capacity, and by that we meant not just the numbers of organs that might be there, but about having a health system that's able to support the hope for additional donations. And so the point was about, if a bereaved family is waiting for a donation to take place, that's a very, very strong reason why we need to make sure we have the specialist nurses and all the resources we need to be able to support them through that very most difficult time of their lives. And that could actually be a reason for people to withdraw consent to donate, should they not be able to be supported in that way. And that's absolutely supporting them, because their bereavement is, separate to their donation. But on the other hand, of course, it is something that we need to be very, very sensitive to. So I hope that helps.
Yes, thank you. I'm aware that we are now running out of time, but we haven't run out of topics to talk about. So it's clear to me that this is a growing and important issue that we need to discuss. So I'm now going to hand over to Ray to give us some concluding comments of our seminar. And as a reminder, all the materials from this seminar, including the PowerPoints and other things, the details of where to find the results of the Edith project, will be made available to you afterwards, as well as a recording of this webinar. But Ray, what would you like to say as concluding remarks?
Well, first of all, I have to thank everybody, you for moderating so well, and then also the panelists and Fiona for this very interesting discussion, where many important issues related to organ transplantation and donation were touched upon. And it gives in a different perspective, again, all the points that are raised in the joint statement. And I still want to emphasize the importance of this document that we also will try to publish in medical literature, with which we can go to policymakers, both at the European level, but for national societies also at the national level, to enforce transplantation. But for this, I think that we need to convince everybody that we have to go into the same direction and to do all this together. Some ways to convince people and also to make them follow the same line will be necessary. And for this, I think we all need to collaborate. Now, I would like to thank also the European Commission to give us the opportunity to develop this action plan, and not this action plan, sorry, to develop this joint statement, and especially also the people from DG Santé in supporting us and in communicating with us how to improve the project. So especially Ingrida and Stefan, who were really very helpful. And then, of course, I need to thank also the supporters, the companies that sponsored this initiative, and especially Astellas, who is a platinum sponsor, but also Baxter B. Brown, Bering, Vifor, which are really very faithful supporters of our initiative, and Hansa Biopharma that came along this year for the first time, for which we are also very thankful, because without their support, this would not have been possible. Then we have to thank the Croatian EU presidency. Unfortunately, things did not go as well as we had expected, but that is for obvious external reasons. And unfortunately, also this forum was to inform a presentation at the ministerial conference in Zagreb next week, but that one has also been cancelled. And we are looking forward to other opportunities to spread the message because, of course, our job is not finished and we need to go on later on. And finally, I have especially also to thank our team in Brussels because they had quite a difficult week. First of all, in canceling all people that would come to Brussels on Tuesday, and that was really a last-minute decision, and then to reorganize this into this splendid webinar, which to my opinion is a very, very good tool to bring people together. Actually, we were all the time flirting with 50 participants and about 10 people jumping in and out. So if those were all different people, then we come to something like 60. There were 60 people on our list for the forum at the EU Parliament, but I'm quite sure that at least 15% of them would not have shown up. So as a matter of fact, this is perhaps an easier way to reach more people. And of course, it's also more ecologic than flying in other people to Brussels. But on the other hand, the social and direct contact is of course of interest as well. So we hope that we will be able to go on this project and to add a number of other things and to end up hopefully in a second action plan. I thank everybody for collaborating into this effort.
Okay, thank you very much, Ray. Thank you, very helpful. And we've had a comment from one of our participants to say how much, as a transplant recipient, how much they appreciated the work that you've all put in, and they hope it continues in the future. So with that, I'm going to bring our meeting to a close. Thank you very much in participating in our test of the technology. I think it worked well, and maybe we'll do more webinars in the future. Thank you and goodbye. Enjoy the rest of your evening.
Thank you.
Thank you.
Thank you.
Bye.
Bye-bay.
Well, kidney day tomorrow.
Thank you.
Thank you. Goodbye.